I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hello, listeners. Welcome to the show today. I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. And I am bringing you a guest today who's going to talk to us about treatment options for uterine fibroids, specifically focused ultrasound, which is pretty interesting stuff. Now, she's in the United States and she talks to us about how it is we can access this treatment option in the US. We also talk about what focused ultrasound is doing around the world and how we can access this treatment option for diseases that maybe don't always have the best options, or maybe they're a major surgery. And can we do better? And as always on the show, we have many examples. We're talking about the women that are the examples, that are the trailblazers, that are the ones that are making a difference when it comes to women's diseases and treatment of women's concerns that are non-invasive. So here we are. We're going to talk about focused ultrasound. So let me introduce Dr. Suzanne LeBlang, Director of Clinical Relationships at the Focused Ultrasound Foundation. With her prior clinical experience as a neuroradiologist and having performed hundreds of focused ultrasound procedures since 2004, which is how long this has been FDA approved, by the way, Suzanne LeBlang, MD, now represents the Focused Ultrasound Foundation by interacting with various researchers, clinicians, and manufacturers to foster collaborations. She interfaces with the medical community at various meetings in order to update the foundation staff. In coordination with the communications team, she helps increase awareness through oral presentations and articles. She also assists the chairman and the development team with building relationships with individuals, other foundations, and nonprofits. She has published papers and delivered numerous scientific talks in the field of focused ultrasound. Suzanne received her BA in biology, an MD degree from the University of Miami, 6-year honors program in medical education, and completed her radiology residency and neuroradiology fellowship at the University of Miami Jackson Memorial Hospital. Now, you can find out more about everything we talk about today on the website for the Focused Ultrasound Foundation. It's fusfoundation.org. Okay, so uterine fibroids we talk about, because listen, there's a lot of women that have uterine fibroids and the options for treatment are not great. They're basically medical treatments, taking medicines if they work. Lots of the medicines have significant side effects. And then if that doesn't work, then we're talking about hysterectomy. And we know that's not as benign as taking out a uterus and everything's hunky-dory. We know that the uterus actually has various functions in the body, not just reproduction. So women who have a hysterectomy are actually far more likely to have dementia and Alzheimer's, as the research shows us. So we know there's a lot. It's not just an organ of reproduction. We know that there's other functions that obviously we haven't yet discovered. So Dr. LeBlang and I talk about uterine fibroids and how the focused ultrasound actually can, without injecting or inserting anything into the body, can treat uterine fibroids, which is amazing to me, using thermal ablation, basically. MRI guided ultrasound machines. She talked about there's the different technologies, which are really interesting to think about. And apparently, different countries have access to different technologies. Again, so interesting. Now, the Focused Ultrasound Foundation is a nonprofit, and they're an information center for women. So please go to their website. You can find out whether or not what you may have going on in your body can be treated by focused ultrasound. I know I will be recommending this for my patients as well. Now, of course, you get two brain people together. We're going to talk about the brain. So we talked about how the focused ultrasound is being used not just for uterine fibroids, not just for thyroid nodules, not just for breast tumors, but also for Parkinsonian tremors and the dyskinesias that come with the medications that are a side effect of the medications for Parkinson's. We also talk about essential tremors, which when women can have the essential tremors, which is a family tremor. So if your, uncle on your mom's side has a tremor, and then your mom has a tremor, and then you show up with a tremor, that's typically a familial tremor or an essential tremor. And there's just not great treatments for that. I mean, it's deep brain stimulators that can be inserted into the brain and that sort of thing. And brain surgery is not to be taken lightly. And so anytime we can do options for this, that treatment options that help with the symptomatology without causing more trouble, I think is always a good thing. And finally, Dr. LeBlang talks to us about the research that's being done right now, targeting the plaques of Alzheimer's using focused ultrasound. So all the way around, a really interesting conversation. Such a pleasure to be in the company of somebody who's just as passionate about women's health as I am. So please welcome to the show, Dr. Suzanne LeBlang. I hope you enjoy this conversation as much as I enjoyed being a part of it. Thanks for listening. AG1, the way I start my healthy days. With my AG1, I get a daily dose of vitamins, minerals, pre- and probiotics, adaptogens, and more. It's daily self-care for my busy life. It helps me fill the nutrition gaps, supports immune health, and supports gut for healthy digestion. It's once a day, easy to drink, and packed with bioavailable ingredients in a convenient formula. I am proud to have had AG1 as a sponsor of this show for many years. It's a nutritional supplement I stand behind and I take every single day. Start with AG1 and notice the difference for yourself. It's a great first step to investing in your health. Try AG1 and get a free bottle of vitamin D3, K2, and 5 free AG1 travel packs with your first purchase at drinkag1.com/Fiona Lovely. That's a $48 value for free if you go to drinkag1.com/Fiona Lovely. Check it out. Welcome to the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely, and I'm joined today with Dr. Suzanne LeBlang of the Focused Ultrasound Foundation. You are the Director of Clinical Relationships. Now, I think we've got a lot to talk about today. Dr. Suzanne LeBlang, thank you for coming to the show.
We certainly have a lot to talk about, and I just love the name of this podcast. So thrilled to be here. Love it.
Thank you. Thank you. Thank you very much. It stood the test of time, that name, let me just say. Probably 20 years ago, I started doing lectures in the community where I was talking about menopause, and that's the name I settled on, and then morphed into a podcast. Who knew? All these years later, here we are still saying it. Anyways, you're a neuroradiologist by trade. Please tell us, how did you find yourself to med school and to the practice of neuroradiology?
Yeah. Just a little bit of background about myself. I was very fortunate that my father was a physician. He was a cardiologist, and he absolutely loved the practice of medicine and taking care of patients, which obviously influenced me tremendously to go into medicine. He passed away while I was in medical school, which furthered my drive to improve the lives of patients suffering from a variety of conditions. So through medical school, I was trying to carve my own path. I thought I would be a cardiothoracic surgeon, right? Because I came from a cardiology background and I loved surgery. But then my aunt actually had multiple sclerosis, which is a neurological disorder. And I watched the course of her disease because our family was medically oriented. We took her to her doctor's appointments and kind of saw how imaging specifically impacted her treatment, right? We could diagnose the disease on MRI scans and look for relapses and change therapeutic courses. So I think that my Aunt Marlene was probably my biggest drive into going into neuroradiology. I wanted to make an impact in the lives of patients that were unfortunately suffering from neurological disorders. So that was my entree into the neuroradiology field.
It's pretty fascinating stuff. Now, you, while you were working as a neuroradiologist, ended up doing a number of procedures, or probably lots of procedures, using focused ultrasound. So tell us about that. Number one, what is focused ultrasound and why do we as women need to know about it?
Sure, sure. So there's a lot in that question, but I love
Yes.
answering it. Okay, so are you ready?
Yeah, I'm ready.
Okay, so as a neuroradiologist, I also trained in neurointerventional, which means you do imaging of the head and spine and neck, but you also do procedures of those areas with catheters inside the body and things like that, and needles and things like that. So fast forward, I was in a practice doing neuroradiology, and all of a sudden, this technology came on in around 2003 that was called focused ultrasound. And our practice was slanted to buy the first focused ultrasound machine approved after FDA approval in 2004. And the first FDA approval for focused ultrasound was uterine
Uterine
fibroid.
fibroids.
Correct.
Wow.
So
Very
now
common.
the question is, how do I go from being a neuroradiologist to treating fibroids? And this is how it went down. Are you ready?
I'm ready.
Okay. So the day of the first procedure of focused ultrasound after FDA approval was a big deal, right? The press was there, everyone from the company was there, which is Insight Tech, made the machine. And my boss at the time was slated to do the procedure because he was a body imaging expert, right? A body guy. And at the last minute, he was unable to come to work that day to do the procedure. And I got a call from his wife and said, listen, Susie, I know you guys are doing the first fibroid case today. Since you're the only female physician in the group and you know where the uterus is, we want you to do the procedure.
Because you know where the uterus is.
I swear this is how it happened. I swear.
Wow.
Wow, this is like a punishment because I'm a woman, right? I'm a neuroradiologist. And then I said, you know what? People ask you to do something, you do it. And I sat down along with the application specialist from Insight Tech and my knowledge of sitting in on the in-services the year before because I knew we were getting the machine. And I did the procedure and listen to me. Every time I pushed the button, and I'm going to tell you what this machine does, and I saw that the patient was awake on the table and felt almost nothing. I was like, this is incredible. And after the 4 hour long procedure, this woman that was suffering with fibroids got up from the table and literally was like, can I go back to work now? And I knew what I had done inside the body because I could see the changes on the MRI scan.
Mm-hmm.
And after that, when my boss came back to work the next week, he's like, I'm so glad the procedure went well. We're so excited to do this here. You'll have to tell me what you learned from it. And I said, listen, I'm so glad you're back. But from now on, I'm doing all the focused ultrasound procedures.
Wow. There are no errors, right? There's just no errors. You were meant to do that.
Yes, and it has taken me on a journey forward that I could be here today and hopefully talk to you and all the people listening on the podcast to talk about the amazing things that focused ultrasound can do. So
Well, and let's talk about that. So in the case of uterine fibroids, what is actually happening when you're applying the focus ultrasound procedure?
so focused ultrasound is a way to change the inside of the body without any incisions, without any needles, and without any radiation. So you're going to say to me, how is that done? Well,
Yes,
I'm going to give you an analogy first, okay?
please.
So when you're young, you go out in the sun and you take a magnifying glass, you can make a leaf catch on fire because the sun's rays converge because of the magnifying glass on a spot on the leaf and it can catch on fire, right? Well, instead of using the sun's rays, you can take an ultrasound beam, the same ultrasound beam that you use to look at your gallbladder or look at a baby when you're pregnant. Take an ultrasound beam, and instead of the beam going across the abdomen or wherever you want to look to create an image, you make the beams converge at a focal spot. And at that focal spot, based on the energy and the parameters of the beam, you can make really important biological changes happen. In terms of uterine fibroids, the mechanism we use is called thermal ablation, which means we raise the temperature of the tissue in that focal spot inside the fibroid to over 60 degrees Celsius, which is 160 degrees Fahrenheit. And when cells are in that hot an environment, they die. It's coagulative necrosis. The sodium potassium pump stop working, the cellular or the organelles just stop working, right? So heat ablation is used in a lot of things in medicine, right? You can do thermal ablation of breast tumors, you can do thermal ablation of liver tumors. The difference is that up until now, you needed to stick a cannula or a catheter into the lesion and then heat it up with some kind of electrical apparatus. Now you can heat up the tissue without any needles or catheters entering the body. So that focused ultrasound beam, as it goes down, it goes through the abdominal wall, goes through the subcutaneous fat, goes through the muscles, goes through all this tissue until it reaches the fibroid. Only at that focal spot where the beams converge, which you can control being the size of a grain of rice or the size of a coffee bean, will you get the biologic effect and the tissue being killed. Along the beam path, it's not hot enough to heat anything up.
Oh,
So it's
so
literally like a
interesting.
video game where you direct the beam in for 30 to 60 seconds, you heat up that area. And in the MRI guided focused ultrasound machines, you can actually watch the temperature rise because you can use the MRI machine like a thermometer. So you can see it going up, 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 reaches the thermal temperature, done. There are also ultrasound guided focused ultrasound machines where you can watch what's called a bubble cloud. You can watch the echogenicity or the color on the ultrasound beam change from like gray to white, and you know that's the area you're killing at the time. But it's truly amazing. I mean, I sat there and I had to trust that pressing a button, that was the hardest thing actually. Because before, when you're an interventional radiologist or a surgeon, you're used to using your hands and touching something inside the body or pushing a catheter up through an artery or through tissues to get to where you want it to go. And you know where your hand goes, the catheter goes. Here, you position the beam like a video game and put it where you want it to go. And then you press a button. And you have to trust that that machine is going to do exactly what it says it's going to do. So for someone as old as me, who's in menopause,
Yes.
that is number one, a leap of faith, but it's
Hmm.
also amazing that in my lifetime of practicing medicine over the last 30 years that I have lived through that transition now and
I
could
love it.
see that surgeries are going from invasive hysterectomies or myomectomies to less invasive procedures like RF ablation of uterine fibroids or uterine artery embolization to now something that's completely incisionless and without any radiation.
Interesting. So, how effective is it at getting rid of these uterine fibroids?
Right, right. So, I want to be careful how we use the terms. So, get rid of. I think let's try to find some other terminology here.
Please.
So, unlike surgery where you remove the uterus and you remove the fibroid, obviously, or you do a myomectomy where you scoop out the fibroid, this is more similar to uterine artery embolization and like RF ablation procedures where you heat up the fibroid or you cut off the blood supply with UAE. So the fibroid is there, but it shrinks over time. So it doesn't just get rid of it, it shrinks and the dead tissue gets resorbed by our body. Dead
Hmm.
tissue all the time is getting resorbed in our body and excreted through our waste, right? We get new cells, old cells die, we get rid of them. So the fibroid shrinks over time as the material gets reabsorbed. So it shrinks, it gets resorbed, it gets smaller, and importantly, you don't have any functioning fibroid tissue. So that blood supply that used to go into it that made it engorged and all that, that improves the symptoms. So it improves symptoms by decreasing the blood supply because you're killing the cells and by shrinking it. So there's less pressure on the adjacent structures like the bladder with patients who have frequency, less blood flow. So you get less heavy menstrual cycles
Hmm.
and things like that. So that's how it improves the symptomatology.
Well, and uterine fibroids are so common, as you and I both know, as women in somewhere in the menopause transition. So we know how common it is. And I'm struck by the minimally invasive nature of this. I think that we, need to do better in terms of how do we treat these common women's issues, whether it's thyroid nodules,
Mhm.
then you remove the whole thyroid. Well, that doesn't make sense at all. I mean, I know that's what we do, that's what medicine does, but can we come up with a better option? It's the same when it comes to hysterectomy, fibroids, and these sorts of things. So, can focused ultrasound be used for thyroid nodules?
Yeah, it's in trials for thyroid nodules, and the results are promising, and for other things. But I want to get back to fibroids for a second, if you
Yes,
don't
please.
mind, because you
Please.
mentioned something that was really interesting. Millions of women, over 10 million women a year in the US alone, suffer from uterine fibroids, right?
Mhm.
But because of our jobs, either in the workplace and or as a mother and all of our responsibilities, most women kind of live with the symptoms. They're like, okay, this is what I have. Because only 500,000 women a year get a hysterectomy. Only, I think, 50 or 60,000 get myomectomies, and even fewer get RF ablation or uterine artery embolization. So just looking at the big picture, so few women who have symptomatic uterine fibroids actually get treated because they don't like the
Get
treatment
treated.
options. The
Yes.
less invasive things that you can do are to take medications, but there's also a lot of side effects from medications as well, right? So the problem is women either ignore the symptoms of their fibroids and they live with it because they don't want to have a definitive treatment because they don't want to be down for surgery or a procedure or deal with the side effects from the medication.
Or
And
can't. Or
then
can't. Yeah.
they start to grow then. And the larger
Mhm.
the fibroids get, the harder they are to treat. So I just feel like women are in a no-win situation here
Yes.
with the existing treatment options. And that's why I've been so passionate about the
Hmm.
uterine fibroids and the potential of focused ultrasound, because if you can, if women are confident that there's a treatment out there that they can endure with little downtime and few side effects, maybe more women would get treated when the fibroids are smaller, which would decrease the overall impact of their lives eventually, right? Increase their
Absolutely.
reproductive abilities, increase their work productivity, increase their
Hmm.
ability to enjoy their time with their children and their lives. So it really has the potential to become a good tool in the toolbox, right?
I love it. I love
Yeah.
it. So, how do women, you're in the United States. Of
Mhm.
course, the podcast is listened by women, it's women around the world to download this podcast. So, what do we, first of all, is it available to all women in the United States? How do we access it? And if we're
Mhm.
outside of the US, then how do we go about asking for this procedure?
Yep, yep, yep. So, it's a really sad story of the history of focused ultrasound in the United States. And I say that because I want to empower women to get involved. Since it was the first FDA approved indication with focused ultrasound, the healthcare community didn't really know how to posit it, right? What kind of procedure is it? It's not surgery. It's not an invasive procedure, but it's not a medication, right? What is this? So the insurance companies didn't know how to posit it. They didn't know how to deal with it in terms of reimbursement. And they really wanted long-term data, right? Other than just 2-year data to show that that it would last a long time, right?
Hmm.
And I didn't disagree with that, right? But we also wanted to get it to patients sooner than later. So do we have to wait 10 years to approve this, like insurance-wise for patients to get it?
Hmm.
So it fell into this black hole where they didn't reimburse it for so long that it kind of fell out of the purview of the OBGYNs and the patients, right? So we finally got data. It has absolutely been used significantly outside the US because they had so much more advancement in those areas, right? So I'm going to give you some statistics. I'm just going to look here for a
Please.
second. In 2022, it was 200,000 FUS procedures for fibroids out of 565,000 around the world. So that's predominantly in Asia. So there were so many machines in Asia, and there are 270 treatment sites in Asia versus only 11 in North America in 2022 and 32 in Europe. Okay. So think
Wow.
about how few sites we had here compared to Europe and Asia, right? On the other hand, prostate focused ultrasound procedures for men,
Don't even. Don't- Go on.
you ready?
I'm ready. I don't think I'll ever be ready. Go on.
Only 41 sites in Asia, but guess how many there were in North America and the United States? Remember, there were only 11 in North America for fibroids in 2022.
Um,
171.
Jesus Murphy.
171 for prostate,
Okay. Okay.
210 in
All right.
Europe.
All right.
And listen, I'm
Yes.
happy for all those men. I really
Yep.
am. I'm very
Me
happy for
too.
them.
Hmm. Yeah. Mhm.
But as you know, disparity in women's
Oh
healthcare.
my God, it's huge. And we talk about it a lot on the show, Dr. LeBlang. The truth is, it comes under that same category. We're giving all these men the Viagra, but then we need lubricated vaginas that actually enjoy intercourse in order to take care of all of those guys on Viagra. It's the same kind of thing. Anyways, back to the
Exactly.
program.
Exactly.
And neither of us is surprised, right? Because we've been doing this far too long. We know that's the way it is. So,
But I will tell you that there is hope and there is
okay,
promise, and I hope
okay.
people get involved. So there are different types of machines that can do this focused ultrasound for fibroids and other parts of the body, right? There's the MRI guided systems,
Mm-hmm.
which Profound and Insight Tech were in the market. And now Profound is predominantly in that market for the MR guided focused ultrasound procedures. So those have to be done inside an MRI machine, which brings up some good and bad, right? The good is
Mm-hmm.
that an MRI scan is the best way we have at looking at anatomy. So you can see the fibroids and the surrounding tissues super clearly to target it really well. You can also do the MR thermometry to see the temperature rise. So if we see the temperature only gets to 58 degrees, I can adjust the power on the machine and say, listen, this area needs to be a little bit hotter. We need to heat it up a little bit more. And then I can see the temperature going out to over 60 degrees Celsius. Okay. There are also ultrasound guided focused ultrasound machines, and those are the ones predominantly used in Asia. And those can be done in an office setting because whoever does ultrasounds can do it, right? So OBGYNs do ultrasounds, as you know, all the time on their patients for gynecological disorders, OB disorders. So they're very comfortable with an ultrasound machine. And it just seems like a natural adaptation. So I think the gynecologists are slightly more apt to adopt the ultrasound guided systems. And for a long time, some of the companies that make the ultrasound guided systems, which are mainly in Asia, one of which is Chongqing, said, why do we need to go into the US market? We have so much work here. You know, why go through the FDA and all that trouble? And slowly but surely, the Focused Ultrasound Foundation, who keeps our pulse on all kinds of things going on around the world, has established better relationships with some of these ultrasound guided companies and have convinced them to please come into the US market because our women need to benefit from it, just like the women in Asia and Europe. So
Mm-hmm.
we're very excited that these companies are now coming into the United States.
Great.
The limitation is that due to the FDA, they have to run clinical trials again. So
Mm-hmm.
even though they have tremendous data that's out there, the FDA wants US data as well. So they're going to do some of the studies in the US starting soon again.
But something's moving. So if women are
Exactly.
listening and not in Asia or Europe where we can easily access, how do we access it, please?
So on our website, the fussfoundation.org website, you can actually search for diseases particular. So you can search fibroids, you can search for treatment sites, and you list where you are, and it will show you the treatment sites that are available in the United States.
Okay, amazing. And as for now, it's sometimes covered by insurance, not at all covered by insurance. Where is that on the landscape?
Yep, there are some insurance companies that cover it,
Hmm.
and many that don't, unfortunately. So you can still
Sadly.
do a cash pay
Yeah.
option, but you have to check with your institution, the provider, and your insurance company to see on the insurance. But it is not widely covered, and
Darn
we've been
it.
working hard at it, and
Yes.
we're trying.
Yes.
The
Of
good
course.
news is that since the fibroids started with this issue, there are now 9 clinically approved indications in the United States to treat tissues with focused ultrasound in the brain. It's for essential tremor and symptoms from Parkinson's disease, pain from bone metastases, fibroids, prostate, some soft tissue tumors. So the good news is the government and healthcare systems are getting more familiar with it and providing insurance for some of those um, for some of those diseases. So we're confident that moving forward now, fibroids will get a relook and for people to
Yes.
see the potential value of it and understand it. Yeah.
Well, from my understanding, the number one and number two most performed surgery in the United States are surgeries done on women. So if someone's paying attention and saying what's going to be profitable, something like this can be, I mean, we have to talk about profit in healthcare if we're talking about the United States. It's just part of the
Yep.
conversation. So we have to see that,
Yep. Yep.
potentially there's a lot of uteruses that are not uteri. What's the word? The plural for
Uterized.
uterus. Yes, exactly. That are just not being treated. Okay, I want to let me ask this: if someone's listening to this and wondering if whatever they are working with, whether it's a uterine fibroid or it's Parkinson's or it's a breast tumor or something like that, if it could be, if what they've got could be treated with focused ultrasound, where do they go again?
Yeah, so great question. So the Focused Ultrasound Foundation is a nonprofit, and we represent all the different companies in the space and everything. So we keep our pulse on everything. So if you go to our website, fustfoundation.org, you can see what's called a rainbow chart. And it lists the over 170 clinical indications that are at various stages of research, from preclinical testing to clinical testing to even regulatory approvals and insurance reimbursement. And you can follow the rainbow chart to see all the different clinical indications in various organ systems: cardiovascular, neurologic, gastrointestinal. It's all in there in our rainbow charts. So you can either search for the term, look on the rainbow chart, and each indication has a separate page where you can learn about the disease.
Yes, amazing, fantastic. Hello, anxiety, my old friend. Do you ever find yourself replaying the same thoughts over and over, like a bad Spotify playlist you just can't skip? Or maybe you've been reaching for that nightly glass of wine to unwind and de-stress, but it causes you to wake up at 3 a.m. feeling regret for drinking it in the first place? I totally get it. Life is busy, your mind is racing, and stress is your unwelcome plus one. Enter Trocom by Troscriptions. It's like a reset button for your brain, but better. These little troches dissolve in your mouth, helping to take the edge off, quiet the noise, and stop those incessant late night thoughts, leaving you feeling calm and collected. And guess what? It's a guilt-free replacement for that wine. It'll help you relax without messing with your sleep. Whether you're juggling work, family, stress, or just trying to steal a few moments for yourself, let Trocom bring your chill back on demand. Visit troscriptions.com and try it out today. Your mind and your sanity will thank you. Use code LOVELY10 for 10% off your order. Thanks, Troscriptions. Okay, let me ask this question because I'm just, you dropped a couple of little nuggets, and I know you guys have done some research on Alzheimer's in particular, another disease that primarily targets women. So talk to me about what the focused ultrasound application is, or that you are doing research on for Alzheimer's, please.
Sure. Okay, so now we're going to switch
Yes.
a bit. Okay,
Yes.
back to my neuroradiology.
Yes, yes,
okay.
Please.
So remember I told you before that you can use the focused ultrasound beam to do a lot of different things, one of which is the thermal ablation, right? You can make the beams converge at a focal spot.
Yes.
That's called high intensity focused ultrasound. High intensity, high temperatures, okay?
Okay.
You can also use it as a low intensity focused ultrasound machine, okay? Different strength of the ultrasound beam, different parameters, low intensity focused ultrasound. So what we can do for things like Alzheimer's disease and other neurodegenerative disorders and even brain tumors is we can open the blood-brain barrier.
Oh boy.
Wow. Oh, you know about the blood-brain barrier?
Well, yes, my specialty is functional neurology, so yes.
Oh, okay, so let's talk. All right?
Go on. Yes,
talk.
Please do.
For the listeners out there,
we talk brain all the time on the show, so please go.
For those of you out there, we have blood vessels in our body all the time that are exchanging oxygen and glucose to our cells and keeping us healthy. But the blood vessels in our brain are very different and very specialized. Okay, the cells, the endothelial cells, are connected very tightly, and that's because we don't want, when we catch a common cold, we don't want the virus to go into our brain, right? When we eat a very fatty meal at McDonald's, we don't want all that fat to go into our brain because our nerves can't function unless they're in a very specific pH balance with specific, nutrients, right? So this blood-brain barrier keeps us safe. However, because those blood vessels are tightly aligned, larger molecules like therapeutics for Alzheimer's disease or MS or brain tumors don't cross the blood-brain barrier in high quantities. So it's been very hard to get high efficacy in these drugs because they don't cross the blood-brain barrier. So there have been many ways that people have tried to bypass the blood-brain barrier, right? You can give certain medications, but then it's all over the brain, not just in one area. You can, some people say radiation opens the blood-brain barrier a little bit. You can directly inject medicines right into the brain where you want them, let's say for certain brain tumors, right? So this is a way with focused ultrasound that you can temporarily and in a spatially targeted manner open the blood-brain barrier for 6 to 24 hours to let therapeutics in, and then it closes up. So, for example, in Alzheimer's disease, studies have shown, and there's probably 10 or 15 published papers already, that have opened the blood-brain barrier in areas of the brain that have amyloid, right? Which is the most well-known pathophysiologic mechanism of the Alzheimer's disease, right? The amyloid and then the tau, but amyloid especially. So they've opened the blood-brain barrier in the frontal lobes where you have plaque, in the hippocampus, and in other areas of the brain. And they've shown in a lot of studies that you can safely and temporarily open the blood-brain barrier in multiple areas of the brain with amyloid. And you can safely do this on multiple occasions and in larger areas of the brain. In fact, the most recent study was just published in the Journal of Neurosurgery, where they opened about 43 cc's of brain tissue bilaterally in patients with Alzheimer's disease. So just opening the blood-brain barrier alone has been shown to decrease plaque and improve some symptoms of Alzheimer's disease. And how does it do that? When you open the blood-brain barrier, you expose our own innate immune cells to see that there's plaque there, and plaque is like garbage, and we want to get rid of it. So our own immune cells go to these areas of amyloid, digest it, and it's also been shown that focused ultrasound BBB opening also opens the blood meningeal barrier where the lymphatics are, so it helps clear the plaques. So it digests the plaques and clears the plaques.
That's
so
cool.
Again, we're in clinical trials with that, and it's so exciting. And the next kind of stage on that, so BBB opening alone can be helpful, is that we can also improve the drug delivery, right? So a landmark study just came out of West Virginia University, the Rockefeller Science Institute in 2024, where they gave patients aducanumab, right, an anti-amyloid antibody, and you give it, intravenously, and it's supposed to go however it can into the brain, everywhere, because it's injected intravenously. So what they did was they also did focused ultrasound blood-brain barrier opening in one side of the brain, okay, in the left frontal lobe. They didn't do the focused ultrasound to the right frontal lobe. And they did amyloid scans before and after. And what do you think they showed?
What happened? Do tell.
You do not have to be a neuroradiologist to see the effects on this picture of the amyloid scan. A dramatic decrease in the amount of amyloid in the side of the left frontal lobe where they also gave the focused ultrasound as compared to the side they didn't do the focused ultrasound with. So it really helped clear the plaque, likely because it opened the blood-brain barrier, like we talked about before, and you got more medicine in that area.
Right. Blood-brain barrier opened, the immune system now can come in and do its job better. So how did that change for the listeners? How did that change the symptoms? We saw how it decreased the plaques in the left frontal lobe. Then how did it change the symptomatology for those patients?
So these initial studies are mostly for safety and feasibility. So they were shown to be safe, great, and feasible. Yes, we could do what we wanted to do, meaning what area we targeted, we were able to prove that we opened the blood-brain barrier in that area with gadolinium, a contrast agent. So that was important. They do perform a lot of tests on memory, cognition, and neuropsychiatric effects from Alzheimer's disease, and they ran all of those tests. In the blood-brain barrier opening studies, where they targeted the frontal lobes, they showed a decrease in the CGA-NPI score, that's the Caregiver-Administered Neuropsychiatric Inventory score, and showed significant improvement in that score in the latest paper, which makes sense. They targeted the frontal lobe. So the next step is to do more cognitive studies when they open more areas of the temporal lobe and the hippocampus, where a lot of the memory is, right? So we have to open more areas of the brain and test it in the areas where we know memory. So we can open the blood-brain barrier like we talked about, with or without the drug. The other way you can do low intensity focused ultrasound is with what's called neuromodulation. So we don't even open the blood-brain barrier, but we do this thing called neuromodulation, which we're affecting the way the nerves kind of function. So we can take nerves that are not firing enough, make them fire more. We can take nerves that are firing too much, like in epilepsy, make them fire less. But in patients with Alzheimer's disease, it's been shown in numerous studies that neuromodulation alone can improve cognition.
Wow.
Right?
Awesome.
So that's very exciting because it's a lower power, and we're trying to figure out what that magic parameter set is to maximize that outcome. So we're still in important clinical trials, but the early results do show some improvement in cognition with just the neuromodulation.
That's amazing. So is the neuromodulation mode, is that the same way you're targeting Parkinson's in the brain?
Great question. Okay. So for the treatment of the motor symptoms of Parkinson's disease, whether it's essential tremor or even the dyskinesias, as well as the ones from essential tremor, for those symptoms, we actually do the thermal ablation of a specific part of the thalamus called the
Substantia.
VIM nucleus of the
Ah,
thalamus to interrupt
okay.
those circuits.
Okay.
However,
Yes.
we are finding some interesting clinical studies that are doing neuromodulation.
Is it to the substantia nigra? Is that where you're doing the neuromodulation to?
Oh my God, you're so ahead of your time. So in the substantia nigra, we can think about even doing gene delivery
Wow.
for
That's
Parkinson's
awesome.
disease to get more dopamine produced and stuff like that. But for the
Yes.
neuromodulation, remember
Hmm.
everyone's shape of their head is different.
Hmm.
Everyone's shape of their brain and their cortical to white matter content is different. So even though we used to use atlases to find that exact place of the VIM nucleus of the thalamus,
Hmm.
everyone's sweet spot is a little bit different.
Sure.
Right? Everyone where
Yeah.
their tracks cross is a little different. So we can do something with radiology called tractography, and we could
Hmm.
look at the cortical spinal tracts and the medial lemniscus and all the tracks to figure out where we want our tract to be in the dental-rubro-thalamic tracts. Like where is it in that patient? So it's very um, precision medicine oriented now because we really treat everyone different and look at their
It's
brain
amazing.
differently. But think about it, if you could do neuromodulation kind of around that area and find the sweet spot before
Hmm.
you ablate it,
Hmm. Hmm. I love it. I,
that could be
I love
sweet,
it.
right?
Dr. Suzanne, it's not very often I get to speak super nerdy brain stuff on the show, and I'm just so excited. You just don't even know. I'm so excited. So thank
I
you for
love it
bringing
too.
it. Well, and I know you arrived here today thinking we're going to talk about uterine fibroids and fun, but then all of a sudden you're like, wait a minute, we can talk about brain too. Yay!
But you know what? Like all these things we talk about, like the movement disorders from Parkinson's disease and essential tremor, think about it. It happens in older patients,
Hmm.
older women.
Hmm.
The problem is when we fall down because we're osteoporotic, we get fractures, right? We don't have a lot of leeway,
Hmm.
right? So anything we can do to improve our health span,
Yes, ma'am.
right, while we're alive to prevent injuries or secondary injuries is important, right? So
Absolutely.
if a woman has a tremor and it's, causing them to have imbalance or Parkinson's disease, think about getting treated with something like focused ultrasound because it's no incisions, different than DBS, no catheters are put into the brain. You don't have upkeep of those deep brain stimulation devices, right? It's one and done, right? So, there are options now in treating a lot of things that women suffer from that they didn't have before. And options are good, right?
I'd say, and if we can make these things minimally invasive and save us, from being
Downtime.
downtime. Yes, because the truth is the world runs on women's backs.
Mhm.
The guys think it's them. Eh, let's just see. Let's
Yeah.
just see. Anyways, where can I know there's a lot of women listening. I know my community is hearing this conversation. By the way, I want to say this. It's an it's a very interesting day for us to have this conversation. My mother had Parkinson's and Lewy body dementia, and
Right.
so prevention of dementia and Alzheimer's is a special interest place for me, for my own self, for my family, and for my patients. And in a really strange twist of the fates, it was a year ago today she passed. And so
Um,
I thank you for being here and for delivering these alternative things, because the truth is these are nasty motor disorders. We don't know how to treat them. We can do okay with them, but they change the quality of someone's life in such a way. And so thank you for your passion with this, whether it was about the uterine fibroids and the fact that you were there and you were the one who showed up because you knew where the uterus was, which is so absurd to think about it now. But thank you for bringing your passion and continuing. I can feel it. Please, please carry on doing this work, because it's on the backs of women like you and I that are bringing new awareness to areas that, we maybe haven't looked at before. So I thank you for that.
Well, thank you. Thank you for sharing your story. And I know that can't be easy, and it's a day that she would be proud of you doing this podcast today.
She
And,
would.
just like you have someone in your family, I'm sure every person out there that's listening has a family member or friend that is suffering from one of these diseases, if not more than one.
Yes.
And if we all get engaged and learn more and talk about it more and demand more, we can make meaningful changes.
Yes, absolutely. So, is there something that the listeners can do with their own doctors in their own communities to help bring awareness to focused ultrasound as an option?
Absolutely. First of all, please go onto our website, fussfoundation.org, and look up your disease that's meaningful to you, right? Also, we have a newsletter that goes out, and I have to say, our newsletter team is outstanding. We put really cool, innovative articles out there that are talking about the latest outcomes of research and all of the different clinical trials, new commercialized machines that are out there, new reimbursements that are out there. We keep our pulse on everything up to date with focused ultrasound. So yeah, please go on our website, register for our newsletter. You can email me, sleblang@fussfoundation.org, and just stay involved and talk to your doctors about it. Make them have that conversation with you and
To have the
educate people,
awareness.
right? I also have to say, as a physician, it's hard to keep up to date on everything that's happening in your field. And sometimes our patients best educate us, right? With all the
Oh,
direct-to-patient
absolutely.
marketing and information on the internet. And if you have a certain disease or ailment, you may be more well-versed in it than some of the doctors. So talk to your doctors about it and teach them too. It's a two-way street, right?
Absolutely. Absolutely. And my experience is that most of us treating women and women's families is that we want that help. We want,
Yeah,
we want to learn. Is there something new out there? I always say my patients are my best teachers. That's always been
exactly.
true. Yeah.
Yeah.
And so that's just a fact. Okay, I have a final question, Dr. Suzanne LeBlang, that I
Sure.
ask everybody that comes on the podcast. And so please have a little fun with this. So, knowing what you know now, what would you
Mhm.
tell your younger self?
I would tell my younger self that whenever you think one door is closing, it's really opening in the other direction. And don't be afraid to walk through it
I love
because
that.
amazing things can happen. Right?
I love it. I love it. Dr. Suzanne LeBlang, clinical director, director of clinical relationships at Focused Ultrasound Foundation. There, I got it right. And
Yep,
that's FUS Foundation, FUS Foundation.org
correct.
is where people can find you. Thank you so much for the time, Suzanne. Thank you for bringing the
Take care of
goods.
yourself today, okay?
Yes, I will. Thank you very much.
Okay,
Bye for now.
bye.
The information and other content provided in this show or in any linked materials is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.